It is 12:01, and I will call this second meeting of the House Standing Committee on Banking and Insurance to order. Mr. Secretary, please call the roll.
Representative All.
Here.
Representative Ballman.
Present.
Representative Bray. Representative Camuel. Representative Kleins.
Here.
Representative Duvall.
Here.
Representative Gooch. Representative Gordon. Representative Grossberg.
Present.
Representative Hampton.
Here.
Representative Hancock.
Here.
Representative Heverin. Representative Lewis. Representative McPherson.
Here.
Representative Rudy. Representative Smith. Representative Lockett.
Here.
Representative Pollock.
Here.
Chair Meredith.
Yes, sir. We do have a quorum and are duly constituted to do business. Do any members of the committee have guests today that they would like to introduce? Seeing none, we will move on to the business of the agenda. We are going to go out of order just a little bit today. I'd like to give the members that are not members of the committee the opportunity to go first so that they're not having to hang around on the bills that are being called for a vote today. So Representative Moser, if you and your guests would come to the table, introduce yourselves for the record, and then you may proceed with your testimony on House Bill 415, or 423, I apologize.
Thank you, Mr. Chairman. I am very, very pleased today to come before you and members of the committee to discuss House Bill 423. I am Kim Mosier, State Representative of the 64th District. I'll allow my guests to introduce themselves.
Robert Duvall, State Representative, District 17.
Corey Meadows, Deputy Executive Vice President and Director of Advocacy for the Kentucky Medical Association.
Mr. Chairman, we do have a committee substitute.
Yes.
Motion on sub.
I've got a motion from Representative Lockett and a second from Representative McPherson on the sub. If you would just tell us what the sub does, and I think
Happy
I can
to.
answer that, but go ahead.
Yeah,
Representative Moser.
sure. Well, just very quickly, it corrects a drafting oversight that we caught by amending KRS 205-536 to clarify that the prior authorization exemption program requirements do not apply to Medicaid. That is, in a nutshell, what it does. Okay.
Any members have questions about the substitute? Seeing none, all in favor of adopting the sub say aye.
Aye.
Any opposed? The sub is before us. Proceed with the rest of your presentation.
Thank you, Mr. Chairman. House Bill 423 is all about cutting red tape. It's all about guaranteeing greater transparency and ensuring that healthcare providers can focus on patient care and less on the bureaucratic barriers to care. In streamlining the prior authorization process, we are making it easier for Kentuckians to get the treatment that they need without unnecessarily delays waiting for approval from the insurance companies. This agreed-upon language with insurers and other stakeholders is a product of a summer of many meetings and machinations and including all the stakeholders. I'd like to thank you, Mr. Chairman, for assisting with that. Representative Lockett, thank you. I'd like to, I would be very remiss if I didn't thank Brianna Patterson for her work. Thank you so much. She is probably the world's most patient bill drafter and super smart, so thank you for your help. I'd also like to sincerely thank Hope McLaughlin and our other insurance providers who came to the table in good faith and worked through some really difficult issues. And of course, I also want to thank the Kentucky Medical Association for their unwavering commitment, this is year 4, to ensuring that patient care is being delivered in an efficient and timely manner. I will hand it over to Corey Meadows for a statement, and then I would be happy to go through what the bill does.
Thank you, Representative Mosier, and again, thank you, Mr. Chairman and members of the committee. KMA is here to express very strong support for House Bill 423, and I too want to echo the sentiments of Representative Mosier in thanking her personally for her efforts on this, as well as Representative Duvall. They have been just fantastic champions for this particular issue, and we wouldn't be here today without their very hard work. But also to you, Mr. Chairman, for your insight and your convening of the stakeholders to work through issues, and Representative Lockett has been involved quite extensively from the beginning as well. It truly was a team effort. Now, we all recognize the reason that we're here and we had to deal with this issue is that prior authorization was originally intended to be a tool to ensure appropriate care and manage cost. However, what was designed as a safeguard has evolved into a burdensome administrative obstacle that too often leads to delays necessary medical treatment, frustrates both patients and physicians, and adds layers of bureaucracy to an already complex healthcare system. Physicians spend countless hours navigating prior authorization requirements, diverting their time away from direct patient care. Patients are in turn left waiting sometimes for days or weeks before they can proceed with treatments or medications or diagnostic tests that physicians and other providers have deemed necessary. But we're here today because this legislation represents a meaningful step toward reform. It's the product of years of negotiation and compromise and a critical first step in addressing the most pressing concerns by streamlining certain aspects of the prior authorization process, reducing the overall number, hopefully, of prior authorizations, and introducing measures for greater transparency and accountability. This bill strikes a balance between ensuring appropriate utilization management and reducing unnecessary delays in patient care.
Motion on the bill.
Got a motion from Representative Pollock, a second Representative Lockett. I do have some questions. Do you all want to go on with presentation or move to questions?
Well, I might answer some of your questions in just running through what the bill does. If I don't, I would be happy to answer them
Sure.
later. Okay.
Go ahead then.
All right, so House Bill 423 simply requires the creation of a framework for insurers to establish a gold carding or a waiver program. The participating providers would then qualify for an exemption from prior authorization requirements under certain conditions. These are for specific allowable healthcare services, and it excludes prescription drugs at this time. It is permissive in that if the insurers would like to add any additional services at a later date, they can do that. The insurers would set the terms of the exemption program within the parameters of this bill. It establishes mandatory and permitted provisions and conditions of the exemption program, as I mentioned, and it also prohibits retrospective reviews based solely on a provider's having an exemption. The last few things that this bill does, it requires the Commissioner of the Department of Insurance to submit an annual report that includes information about prior authorization exemption programs and prior authorizations conducted by private insurance. The program does not apply to the Medicaid program, but it does require that the Commissioner of DMS submit an annual report that includes information about prior authorizations that are being conducted in the provision of Medicaid services. I'm happy to answer any specific questions that you might have.
Representative Hall.
Thank you, Mr. Chairman. Thank you, Representative Mosier, for your dogged pursuit of legislation in this space. I know it's taken a long time to get here, and hopefully this is the first step of what we will build on in the Commonwealth towards, making our pre-authorization process as good as possible. You know, I had the opportunity to work at UK Healthcare for a long time. I was on the Epic implementation team in the IT department. We had a whole team that had to do nothing but set up the way that we handled pre-auths and work with the business office on how we would send the electronic communications around the pre-auths. And it's difficult. It's a lot on both the providers and the hospitals to get that right, both from an implementation perspective, but also do it in a timely manner so we can continue to take care of our patients. And that's what our focus should be on, is how do we continue to take care of our patients. My one question, historically, there was a timeout period where if you had gotten a pre-auth and you were getting the same type of treatment or pursuing the treatment again, you would have to get that pre-authorization, the same one that you already had on file again if it was a certain amount of time. Does this address that in any way?
It does not. Thank you for that question, and thank you for your comments about prior authorization. Just commentary, I agree with you wholeheartedly. This is a layer of bureaucracy that we can cut out. It's costly to everyone. And so in answer to your specific question, we don't identify that problem, but if a provider receives an exemption and they need to meet certain requirements, they have to be approved consistently at 93% of the time or better. It's a very high bar. They would have an exemption for a year.
It would be reviewed periodically. The insurer has the ability to review that exemption. As long as they continue to meet the criteria, they would keep the exemption. So there is a review process, but the provider, once they get the exemption, they don't have to come back every year and say, hey, I'm requesting prior authorization again. They have that exemption going forward unless the insurer says you have fallen out of compliance with the criteria, and then they have the ability to rescind that.
So it puts it on the provider to meet that 93% threshold to keep it in place.
Yes.
Okay.
And the beauty of the 93% is that they can go up to 93%. They don't have to. The nice part about this bill is that they can go lower if they so choose. So we tried to build that in as a ceiling and not a floor, so insurers can have the opportunity to customize their program the way they want to. So if they want to go to 85%, they can do that.
Thank you.
Any other questions from other members of the committee? We do have a motion on House Bill 423 as amended by the House Committee Substitute.
Do you want to add anything?
Representative Duval?
I just wanted to say I appreciate the determination and commitment that Representative Mosier has shown over the last several years. This was not an easy process, and I appreciate you, Chair Meredith, as well as Representative Lockett, your work and input on this as well. But this is a great day for healthcare in Kentucky, and when providers and patients see this streamlined process, everyone's going to win.
All right. Mr. Secretary, would you please call the roll?
Representative All,
Aye.
Representative Ballman,
Aye.
Representative Bray, Representative Camuel, Representative Klein's,
Yes.
Representative Duvall,
Yes.
Representative Gooch, Representative Gordon,
Yes, and I'd like to register my attendance as well.
Representative Grossberg,
Aye.
Representative Hampton,
Yes.
Representative Hancock,
Yes.
Representative Heverin, Representative Lewis,
Here. Yes.
Representative Lockett,
Aye.
Representative McPherson,
Yes.
Representative Pollock,
Aye.
Representative Rudy, Representative Smith, Chair Meredith.
Yes, sir. House Bill 423 is amended by the House Committee Substitute. Does pass with favorable expression. Same shit on the House floor. Thank you, Representative Moser.
Thank you.
Representative Duval, Corey. Appreciate you all. Glad you clarified that, Mr. Leader. Next bill we'll call on the agenda, Representative Pollock, House Bill 415. If you would please go towards the table, introduce yourself and any guests for the record. Then you can proceed.
Thank you, Mr. Chairman. Committee, morning. House Representative Sarge Pollock here, District 51.
Representative Pollock, it is the afternoon now, just to be clear with you.
Long night.
For some, I'm in Central Time. Let my guest introduce himself.
Steve Robertson with Frost Brown Todd, representing AFLAC.
Mr. Chairman and committee, thank you, sir. House Bill 415 is legislation that seeks to clarify the intent and scope of previous and future health insurance coverage mandates. which is that these mandates are generally intended to only apply to primary major medical health insurance policies.
Got a motion, Representative Lockett. I hear a second from Representative Rudy. Do you have anything further, Representative Pollock?
No, sir.
Any questions from members of the committee? Seeing none, Mr. Secretary, please call the roll.
Representative All,
Yes.
Representative Ballman,
Yes.
Representative Bray, Representative Camuel, Representative Kleins, Representative Duvall,
Yes.
Representative Gooch, Representative Gordon, Representative Grossberg,
Aye.
Representative Hampton,
Yes.
Representative Hancock,
Yes.
Representative Heverin, Representative Lewis,
Yes.
Representative Lockett,
Yes.
Representative McPherson,
Yes.
Representative Pollock,
Aye.
Representative Rudy, Representative Smith, Chair Meredith.
Yes. House Bill 415 does pass with favorable expression. Same shit on the House floor. Thank you, gentlemen, for being here today.
Thank you. This is a great day for supplemental insurance products in Kentucky. Appreciate it.
This time I would ask my very able co-chair, Representative Lockett, to please assume the chair.
Thank you, Mr. Chairman. Next up on the agenda is House Bill 390 from our esteemed chairman, Mr. Michael Meredith. If you would take the chair, and I believe we have 3 guests via Zoom as well. So if you would introduce yourself, sir, and have those on Zoom introduce themselves as well. Anybody else in the audience that would like to join at the table?
I'm just going to bring everybody in the
Just
room.
bring
to
them
the
all
table.
up.
Please introduce yourself for the record. Now, Representative Michael Meredith, representing the 19th House District.
Anne Marie Franklin, Kentucky Farm Bureau Insurance.
Chris Nolan with the Insurance Institute of Kentucky.
And Dustin Miller, State Farm, behind us as well. If my guests online would introduce themselves for the record, please.
Hey, good afternoon. Todd Feltman from State Farm Insurance and chairperson of the Insurance Industry Committee for Motor Vehicle Administration.
Hi, Chairman Meredith. This is Sharon Clark. I'm the Commissioner of the Department of Insurance.
Sean, I think your mic's off. That is Sean Orm with the Department of Insurance as well. Sean, you're having a little technical difficulty, I think. It's good to be here with you and to have House Bill 390 in front of you. Reason I bring all of these folks to the table today is that it is a unified insurance industry behind this piece of legislation that we see here. You've got State Farm, Farm Bureau, and the Insurance Institute of Kentucky all standing at the table with us, as well as the commissioner online as well. What House Bill 390 does is it seeks to create a real-time insurance verification system for motor vehicle insurance in the Commonwealth of Kentucky. Over the last probably 2 decades, we've heard a lot about transitions from AVIS to CAVIS. It has taken a long, long time to get to a point where the CAVIS system is now up and running through the Department of Transportation and working inside of our county clerk's offices. It has not been without hiccups, I will admit that. But again, most of that whole system has been transitioned at this point and is working fairly well. One of the pieces that was left in the old system, though, was the insurance verification system and that data left on the old database. And so what this bill does is it seeks to move that to the new database under CAVIS over a period of time. And it also will shorten the time when insurance companies are batching those records and sending that into the system. Right now, it's a 30-day turn. The bill has kind of like what was mentioned previously, a ceiling of 7 days turn, but it can be shorter if the regulations are put in place to do so at a later date. How this works in practice is this will be a system that once it's operational, the insurers will report all that data electronically on a regular basis so that we have.
Second. We have a motion. Who made the motion? We didn't catch that. Representative Rudy with the motion, and second by Representative Bray. Representative, would you like to continue or would you like to stop?
I have a motion and a second. I will cease.
Yes, sir. Would any of your guests like to offer any testimony?
Just to thank the sponsor for all the work that he's put into the bill. We appreciate it.
Very good. Do we have any questions on the bill?
Chair, I got one quick question.
Yes, sir. Representative Pollock.
I've not been here, but this is my fourth session here. But my question comes up, and obviously, Chair Meredith, you've been here as long as anybody else probably in this committee. Do you have the most guests at your table today? If you broke the record today, I mean, I've never seen so many experts here.
I don't think I have broken a record, but I wanted to have at least as many experts as you did on your bill last year, Representative Pollock. And I will correct for the record, I'm not the longest serving member of the General Assembly seated on this committee currently. That distinction goes to the leader, Representative Rudy.
Oh.
And Jim, I missed you, but Gooch is even longer. So I'm third place, guys.
Okay.
There's
Good
a
to know.
competition going, apparently.
Great history lesson this morning. Thank you.
That's great. Thank you, Representative Pollock. Any other questions at all from the committee? Seeing none, clerk, please take the roll.
Representative All.
Aye.
Representative Ballman.
Yes.
Representative Bray. Representative Camuel. Representative Klein's.
Yes.
Representative Duvall.
Yes.
Representative Gooch. Representative Gordon. Representative Grossberg.
Aye.
Representative Hampton.
Yes.
Representative Hancock.
Yes.
Representative Heverin. Representative Lewis.
Yes.
Representative Lockett.
Yes.
Representative McPherson.
Yes.
Representative Pollock.
Great bill. Yes.
Representative Rudy. Representative Smith. Chair Meredith.
Yes. Mr. Leader, could I have that motion for consent? Thank you, Mr. Chairman, members of the committee.
Sir, House Bill 390 does pass. Same should on the House floor. Thank you, Representative Meredith, and all of your plethora of guests that you brought along with you. And experts, correct. And I turn the chair back over to Chairman Meredith.
Thank you. And now we will have the final bill on the agenda for today, which is for discussion only, House Bill 3. Representative Neighbors, if you would come forward, introduce yourself and your guests for the records, and then you may proceed with your discussion on the bill.
Thank you, Chairman. My name is Amy Neighbors, and I represent the 21st House District. And with me today is...
My name is Ben Mudd. I'm the Executive Director of the Kentucky Pharmacists Association, a constituent of the 51st District, and I can confirm that we are in the Eastern Time Zone, Representative Pollock.
Nice.
Chairman and members of the House Banking and Insurance Committee, thank you for the opportunity to speak today in support of House Bill 3, a bill that ensures fairness in Kentucky's Medicaid system by recognizing pharmacists as providers and allowing them to be reimbursed for the clinical services they already provide. Pharmacists are among the most accessible healthcare professionals in our communities, yet under Kentucky Medicaid, they are not recognized as providers at all. This means that while Medicaid pays for essential services like strep and flu testing, tobacco cessation counseling, and chronic disease management when provided by other non-physician practitioners, such as nurse practitioners and physician assistants, it does not reimburse pharmacists for delivering the exact same care. House Bill 3 corrects this imbalance by ensuring that when a Medicaid patient receives a covered service from a pharmacist, that pharmacist is paid just like any other qualified provider. Importantly, this bill does not expand the scope of pharmacy practice or require Medicaid to cover any new services. These are services Medicaid is already paying for, just not when provided by a pharmacist. Kentucky has already recognized the importance of this policy in the commercial insurance market. In 2021, the General Assembly passed House Bill 48, which requires commercial insurers to reimburse pharmacists at the same rate as other non-physician providers for the same clinical services. House Bill 3 simply aligns our public programs with this existing policy to ensure Medicaid patients have the same access to pharmacist-provided care as those with private insurance. This is not about increasing Medicaid costs. Patients will continue to seek care when they need it, just as they do now. When a new class of physicians graduate, we don't consider that an increased cost to the system. Rather, it's a natural evolution of the healthcare workforce. House Bill 3 follows the same principle by ensuring that pharmacists, who are often the most accessible providers in our communities, can be part of the solution in delivering timely and cost-effective care. This is a common-sense, market-based solution that promotes fairness, improves patient access, and ensures consistency across Kentucky's healthcare system. I encourage the committee to support House Bill 3 and take this important step toward a stronger, more efficient Medicaid program.
Well said, Representative. Thank you. As I said, I'm with the Kentucky Pharmacists Association, and I'm joined today with some members of our board and many more watching at home due to the weather. Appreciate you all hearing this as discussion today, and want to express our appreciation to Representative Neighbors for her leadership in sponsoring the bill. The Kentucky Pharmacists Association represents pharmacists, technicians, and students from across all practice settings in the pharmacy profession. And our mission is to improve the health of all Kentuckians by advancing the pharmacy practice. House Bill 3 is a huge step in doing that. We all know that Kentucky faces serious health challenges. We rank 46th in preventable hospitalizations and premature deaths. And we know that many leading causes of death, including heart disease, cancer, stroke, and diabetes, are all manageable with early intervention. Yet, as provider shortages grow and our costs rise, access to care remains a major issue, especially for the 107 designated health professional shortage areas in Kentucky. For the 1.4 million Medicaid and K-CHIP enrollees in Kentucky, improving access to care is essential. Pharmacies are uniquely positioned to fill these gaps. We have pharmacies in 119 of 120 counties in Kentucky. And pharmacists are often the most accessible healthcare professional that patients have. This is particularly true with Medicaid patients that are often high-risk individuals, and they see their pharmacist 10 times more often than they see their primary care provider. So in addition to that, pharmacists are trained to help manage medications, provide preventative services, and collaborate with physicians to optimize treatment for chronic conditions. Many pharmacies offer Board of Pharmacy authorized protocols, which the representative mentioned, that allows them to do flu and strep tests and treat other acute self-limiting conditions, which could prevent emergency room visits. Outside of our community pharmacies, we have pharmacists that work in health systems and clinics, assisting with disease management and medication optimization for chronic conditions like diabetes and hypertension. Given that 70% of all office visits involve some drug therapy, utilizing pharmacists as medication experts is critical to reducing medication-related complications. We spend $1 treating drug-related adverse effects for every dollar that we spend on medication. So if you spend $1 on a prescription drug, we're treating $1 to treat some problem that causes. And incorporating pharmacists on that team and allowing them to be paid for these services can reduce that. To give you an overview of what the landscape looks like across the country, there are 36 other states have implemented some sort of Medicaid payment for pharmacist services. There are studies that show that for every dollar we spend in pharmacist-led services, we save $4.40. And in addition to that, pharmacists continue to show that they improve outcomes when they are part of the team. Specifically, when we look at diabetes care, one study showed that for every dollar we spent in diabetes prevention specifically, we saved $5.79, also reducing emergency room visits. So House Bill 3 is about breaking down these barriers and not expanding the pharmacist's scope of practice. It ensures that all patients, regardless of income, have access to these services in their communities. By passing House Bill 3, Kentucky can prevent unnecessary ER visits, improve health outcomes, and ultimately save lives. We urge you to support House Bill 3, and thank you again for your time today.
Thank you all. I do have a question or comment from Leader Rudy.
Thank you, Mr. Chairman. Thank you guys both for being here, and thank you for bringing this important piece of legislation. Representative Neighbors, I appreciate your leadership on this matter. You are spot on. It's a no-brainer. It is common sense, like you said. I think it's interesting to point out that the 2021 bill sponsored by then Representative Bentley, drafted originally, had these provisions in it, and he compromised to say, let's get the ball rolling. It was a timing issue. Just like Senate Bill 188 that passed last year, that's so important to the pharmacists across this state, it was timing. It took time to get there. That will be frustrations when we can see something so blatantly obvious that why won't we do it? Well, I would tell you there's always other things going on. And while I appreciate this, so much so that I made sure that it got a good low number like House Bill 3, this is important. You'll see some other bills filed today that will kind of shed light on why we're doing this for discussion only. Chairman Petrie and his team, Representative Bray and Representative Bowling, look at the budget. And our budget woes, when it comes to Medicaid, are skyrocketing. You're going to see legislation filed today that says we're pausing everything Medicaid. No more expansion until we get our arms around this. We cannot continue to have Medicaid eat up the amount of our budget that it is. We don't know what's going on with the federal government when it comes to Medicaid. We will have to react to that, and we probably won't know that until this time next year when we're in the middle of a budget session. So I think it's important to start the conversation. I think this does remain a priority of the majority caucus, definitely, but a priority this term, maybe, instead of this year. So I want everybody to understand that we are looking at this, we are serious about it, but we must get our hands around the issue of the day, Medicaid. And this, quite frankly, even though it would possibly and probably save money in the long term, is an expansion of Medicaid, and we can't do that right now. That is all, Mr. Chairman. Thank you for allowing me to participate. And thank you, Representative Neighbors, for leading on this. It's not lost on us. We're going to get it done eventually.
Thank you, Mr. Leader. Any other questions or comments from members of the committee? Seeing none, Representative Neighbors, thank you again for bringing the bill and for the presentation. Ben, thank you for being here. That does conclude our agenda. Do I have a motion to adjourn? Motion from Representative Pollock, second Representative Locke.